DMC DMC Alumni UK is organizing a wonderful webinar today on how to succeed and excel in MRCP Part 1 and Part 2 exams. Uh, we have a pool of esteemed speakers and panelists today joining us, and they are all really great experts in the field of medicine and education in their own ways. As chief guest today, as our principal speaker, we have Dr. Shariful Halim. I'm sure he does not need any introduction, but for people who might not know, he is currently working as a cardiology resident doctor, Phase B MD doctor in Bangladesh in NICBD, National Institute of Cardiovascular Diseases. That's only part of his introduction. He's done loads of other things over the last few years, which has brought great fame and pride to us as a nation. For example, in the Part 1 exams, he scored an astonishing 930 out of 999 in MRCP Part 1. But as if this wasn't enough, he went on to score 1254 in MRCP Part 2 exam. And this is widely regarded as one of the highest marks in the history of this exam. He also has been doing a lot of other things in the field of medical education. He has his own YouTube channel called Med Sparkle, which has become a worldwide well-known platform for advancing medical education. He has been taking classes for doctors everywhere in the world, not only in Bangladesh, but in general has been a vital figure to advance the state of medical education in Bangladesh. And I'm told that he also, apart from his interest in medicine, he also has an avid interest in football as well, for example. And he used to be a great footballer back in his days in Dhaka Medical College. So Dr. Shariful Halim tells me that he holds his father and mother as his role models in life. And his father is a teacher, his mother is a public health advocate, and I'm sure that his parents would be proud parents. Moving on to the panelists, we have 4 really highly esteemed panelists today joining us, and we are blessed to have their expertise in this webinar. We are joined by Dr. Azim, who is a lead stroke consultant in NHS. We have Dr. Mehboob Hussain, who is the current president of the DMC Alumni UK, and he is also a very senior consultant in acute and internal medicine in NHS. We are joined by Dr. Saeedur Rahman, who is an acute and stroke consultant in NHS, and we're joined by Dr. M Amanat Ullah, who is again a consultant in acute medicine working currently in NHS. They are all very they're all esteemed MRCP PACES examiners, and for people who don't know the process, it takes an arduously long and great effort to become an examiner in MRCP PACES, and you need to uphold certain great excellences in order to be able to be eligible for this. So again, their presence today is a really welcoming addition to our event, and over the course of today, they'll be sharing their valuable tips on how to excel in the MRCP exams in general. So just a few things for housekeeping rules. We have recorded the session so that people who are missing the session can join this at a later time as well. If anybody has any objections to this being recorded, please let us know. But in general, the whole purpose is that so that people can watch it at a later time for people who missed this event. We will be spending the first half an hour to 40 minutes going through different talks from our chief speaker, as well as the 4 panelists. During that time, please feel free to pose any questions that you feel is relevant and you want it answered by either the speaker or our panelists related to Part 1 and Part 2 exams. But I'm sure our esteemed panelists wouldn't mind some questions and tips about PACES exams as well. So if you have any questions with regards to that, please feel free to ask that as well. And then over the last 20 minutes, I'll be trying to cover your questions as much as possible. I'm sure there'll be more questions than we can probably have the time for. But again, I'm sure that Dr. Shariful Halim would be very willing to answer some of the questions which we can't answer in this platform at a later time as well. Just to introduce myself at the end, my name is Latif. I'm currently working as a consultant in acute medicine at Leicester University Hospital of Leicester, and I'll be hosting the event. Thank you. So Dr. Shariful Halim, without wasting further time, I'd probably like to hand over the floor to you so that you can share with us some of your top tips of how to excel in MRCP exams. Dr. Shariful Halim, whenever you're ready. Yeah. So, Dr. Shariful Halim, if you can hear me, I can see you.
Hello, Ryan. Yes, I can hear you. How are you?
I'm fine, thank you. Yeah. So we are ready for you to give your top tips of how to excel in the MRCP exams, part 1 and part 2.
Okay. So should I begin now?
Yeah, you can. I've said my introductions.
Okay. Okay. So thank you very much for your kind introduction. Sorry for the technical delay. So it's really an honor and it's a pleasure to be here and to be surrounded by seniors who we uh, think of our uh, inspiration in the journey of our medical life. So we have seniors from Create 35 and then below. So I mean to share a stage with those legends is immense honor and a privilege again. So I will talk a bit about the MRCP Part 1 and Part 2 preparation, especially who are working physicians, working or trainee physicians working in Bangladesh or other countries. So my focus would be how to prepare well in a short time or when you are not getting enough time for studying. So obviously, I had a big or strong background knowledge, so it was easier for me. But uh, many don't have that background. So how long does it take to prepare for MRCP Part 1 actually depends on your background. I mean, can everyone hear what I'm telling, what I'm saying? I'm not sure actually. Ryan, can you confirm? Can you hear me clearly now?
Dr. Halim, we can hear you really
Yeah,
well.
everything is okay.
Yeah.
But
Okay, okay, okay. Thank you. So first thing first. So whenever you're trying to go for MRCP Part 1, as this exam is a costly exam, you have to go all out. That's what I think. You should not take many chances. You should go all out from the very beginning. The first thing to do is set a specific timeline for your journey that I will take the MRCP Part 1 on this specific time. That would be the first step. And then you have to make this your priority because this is not easy exam. You have to prepare really well, especially you have to get to the bottom of the concept. For example, if you are taking MRCP Part 1, you will be tested on the key concepts that are very essential for day-to-day life. So the concepts of MRCP Part 1 mainly focuses on like the basics of medicine. It starts from our basics of anatomy and physiology, and then it goes into the advancement of the medicine. And MRCP Part 2 will be the extension of Part 1, where you have to take the advanced clinical decision making process. You have to delve into the depths of the medicine. So the first thing for your preparation is taking the materials. The materials that I think for someone with less time would be the Q banks. That would be your base material for study. I mean, every time I see someone preparing for MRC Part 1, every time they ask me for what are the resources, especially what are the texts that you should follow. Is it Davidson? Is it Oxford Handbook of Medicine? Or is it Notes and Notes? But for me, the best resources are not those texts. Rather, the best resources are the QBanks. Why? Because whenever you're going through QBanks has thousands of problems. And whenever you solve the problems, you are more likely to remember the problem and you are more likely to get the answer right. So whenever you start preparing, the focus should not be on your textbooks. Textbooks are essential, yes. The textbook should be the adjunct to your Q banks. You go for Q banks, especially the online Q banks. I'd say subscribe to at least one or two online Q banks. Yes, they are testing material, but you should not use them as a testing material. Rather, you should use them as a learning material. And that's, I think, is paradigm shift, especially whenever we are thinking of someone who is working physician and trying to prepare for MRCP Part 1 and restricted by time. They should focus on those QBanks and the online versions. And why online versions? Because whenever you are solving the online QBanks, you are getting the real feedback. And the feedback is as coming out as a percentage. And you are definitely knowing, or you are getting to know about your weaknesses, where you should work it. So you go through the QBanks, you solve the questions, you will have a lot of wrong questions. Mark those questions, or you will have some right questions or some right concepts, but you are confused. So tag them or flag them. And then study those concepts, take your time in clearing those concepts, and then take the help from the text, such as Oxford or Notes and Notes, etc. But that is my most important tip for anyone preparing. And that's what everybody is unable to do. Everybody goes like, I want to complete, like, I want to study Oxford A to Z first, and then I will start solving questions. No, this is the wrong approach. The right approach is start solving questions from the very first day. Even if you're not solving that many questions per day, no problem. So try, like, do 10 questions first. Then after 2 weeks or 3 weeks, go for 20 questions, 40 questions, 60, 80, 100. So you have to increase the number of questions, after like 1 to 2 weeks periods. And whenever you're solving many questions a day, like more than 100 questions a day, then you will know that you are on the very right track and you are destined for success. And actually, you can predict your success in MRCP by solving those Q banks, because they will give you percentage. I'd say if you are getting like more than 70% in any of the Q banks, like past medicine, past test, and on exam, you're very likely to pass this exam. And if you are getting more than 80% of those Q banks, then your chance of doing well, is very high. Obviously, you will not fail. You will get a really good marks, because those exams, I think they are very well structured, because they cover everything. They have questions from easy to medium to difficult, so multi-layered questions. So if you are taking a very good preparation, there is no chance that you will fail. So one concept that I think you should remember is you should not just aim for passing, because if you are just aiming for passing marginally, then you might fail. So try to master the concept in a way that not only helps to pass this exam, rather this is a learning for your daily practice. This is the knowledge that you use for MRCP Part 2 and also for PACES. So study in a way that not only focuses on your exam, rather you think of this learning as your valuable lesson to practice as a competent physician. Then your learning will be more productive. You will feel well, you will feel good after learning something that it's not only helped me in passing this exam, but also helped me in treating the patients in a very good way. And when you are in a training environment, then try to review the MRCP concept with the patients that you are seeing every day. Like you are seeing a patient of Marfan syndrome, fine. Go back to your tab right now. Whenever seeing a patient of Marfan syndrome, you have your tab with you, go to Marfan syndrome, have a quick review, like 5 minutes, and solve some questions of Marfan syndrome from the online QBanks. Because if you want to solve questions of Marfan syndrome, you just search on the tab, and then you will get the question. And that's how you can integrate your clinical training with the MRCP preparation. But obviously, just before the exam day, I'd say like 1 month before the exam day, or at least 3 weeks before the exam day, try to take a break or try to take leave, because you want to dedicate the whole time for your study, at least 3 weeks or 1 month before the exam day, if it's possible. But if you are in the UK, probably that will not be possible. So you have to, integrate your clinical practice with your study. That would be the best thing to do if you're in the UK. But if you are in Bangladesh, then if you are a government job holder, you might take a leave of like 2 weeks. It's possible you can take that leave. And if you do take that leave, then what you have to do, you have to review all the notes you have made. So whenever you're solving the Q banks, try to make notes, especially the concept that you are confused about or something that you didn't know before. So make those notes by yourself, not very long notes, rather very short notes, and they will be acting as your flashcards or the repetition cards at the end of the Q bank solve. Like before the exam day, you have to review the high yield points that you have written down in your notebooks, own notes, review them again and again. And before the exam dates, I'd say like 1 week or 2 weeks before, you have to take the mock test. And the best mock test is the RCP mock. You have to take the RCP mock. And you can also take the mocks from the Cubans as well. But mock tests are essential because this is an exam where you have to solve a lot of questions. Like in a 3-hour period, you have to solve 100 questions. And then after a break of 1 hour, you have to again solve another 100 questions. So 200 questions in a span of like 6 to 7 hours. So it's a laborious task. You have to like get used to it. And there is no other way to prepare yourself other than taking the mock test. So this is very important because oftentimes what happens is you take the paper 1 very well, but you become exhausted at the middle of the paper 2, and you will miss a lot of questions if you're exhausted at the middle of the paper 2 or at the paper 2. So you have to train your body, train your mind how to go through this. And before your exam day, try to go to the station or your exam center to look around and to have an idea how to go and how to manage the time around the exam. So I'd say those are the things that would definitely help someone preparing for the MRCP Part 1 to excel in this exam. Obviously, there would be some additional points if I have more time. One of the important points is group study. Oftentimes, you do not feel the urge or pressure or the motivation to study a lot of time or long time. Then it's very good practice to have someone who is also in this same path, to have him to solve questions with him, to discuss some concepts with him. That would be definitely a good way to keep you motivated and to keep you on the track. And guidelines. So if I focus on guidelines, the guidelines that I'd say the most important guidelines are, number 1, the diabetes. So you have to go through the guidelines from NICE. The diabetes management will be my top choice because that's where many questions come from. Then hypertension guideline, asthma guideline, and COPD guidelines. So those would be the guidelines that you have to know, A to Z. You have to know everything about those guidelines because those are the areas where you will have large number of questions, large number of concepts. Then how to remember a lot of facts. Because in MRCP Part 1, there are a lot of questions where those are like repetition of knowledge or recall-based questions. So don't only focus on concepts. You have to remember the concept. You have to have a good idea about the concepts. But you have to also focus on recall questions. There are many questions that are just simple fact removal, remembering. How to remember all of that? The way to do that is by using the spaced repetition. So whenever you are making some notes, review them again and again after some time. That would definitely help you to remember them in the exam day. So I'd say those are my tips for doing well. I'm expecting more questions from the audience, and I would like to conclude here and get to Dr. Raiyan.
Thank you, Dr. Halim, for your wonderful presentation. That was really well summarized, and I'm sure people will be able to take a lot of this back to their own practice. Now, what I'm going to do, just to reduce the interference of the background noise, I'm going to, ask for everyone's forgiveness, because I'm going to mute everybody so that anybody who's speaking can just then unmute themselves. So there's a technical glitch going on right now. Yeah, that should be sorted. Sorry for the delay. So I've just muted everybody. So anybody who can speak can just unmute themselves. This hopefully will reduce the background interference of noise that we constantly are getting. So Dr. Halim, it was really fascinating. I'll probably now take the opportunity to bring in our esteemed panelists into the event. So first of all, I'd like to ask Dr. AFM Azim, who again, as I said, is a very senior consultant in stroke medicine in NHS, and he is a seasoned MRCP PACES examiner. So, Dr. Azim, if you wanted to share a few tips of how to excel in the MRCP exams in general.
You have to unmute yourself, please.
Oh, sorry, apologies. I've unmuted myself. So as I said, I've been a consultant in the NHS for more than 22 years, and I've been examining for more than 10 years as well in the MRCP PACES. Now, I know you guys nicely spoke about how to prepare for part one. It is a very difficult exam. I think it's more difficult than passing PACES, if I remember when I took it, because you need a lot of knowledge base. Now, for PACES,
I can't hear you. Is it?
Can't you hear me?
I don't know whether this is only me or not.
Can you guys not hear me?
Would you be able to unmute?
Yes, I hear you, sir.
Can you hear me?
Yes, I can.
Okay.
I can as well. Yeah.
Okay. Looks like maybe Ryan is you. So I will carry on. If you can't hear, please speak out. Anybody who can't hear. So for PACES, I will talk about PACES. You've heard how very well from Dr. Halim how to prepare for part one. For PACES, I think what you need to do, this is a very clinical exam, as you are well aware of. There are two episodes, I think, broadly. One is patient interaction, examination skills, and how to present your examination skills. And the other is communication skills, because it is widely tested throughout most of the stations as well. So two things. I will talk briefly about patient interaction. It's very important. Most of the doctors who work in UK will have some understanding, but if you are from Bangladesh, there are slightly different aspects of how you look after patients and how you treat with patients and family. So I think we all do that, but I will still repeat that you need to show respect and dignity to your patients. Ensure that you make them comfortable and feel them safe with you. You ensure that you're professional in your way, how you deal with them, and being sensitive and show empathy. Both to patients, you will have family members sometimes present, or somebody actors as well. And when you talk to them, listen to them attentively. Acknowledge what they are trying to say, and confirm when you talk to them and give some information, always confirm their understanding. Don't presume that they have understood you, and then always clarify if they have not understood anything. It is very important that you do that. Now, and in communication, what I think you should be doing, you should be very clear, structured, systematic, and very you should be very professional, comprehensive, and fluent as much as possible. Okay. I will always say, when you're asked a question or you're talking to it, think for a minute, decide what you're going to say, and then start, so that you will be very much more structured. And when asked questions, show confidence, but not being overconfident. Yeah. So confidence, because what happens, this is an exam that lets you get into the highest specialist training. When you registrar, then what consultants are looking for, can I rely on my registrar to give the information they're going to give me and the assessment they're going to do? So it is important that you show to your examiners that you know what you're doing and you're confident about doing it, rather than structured. So this is how you do a communications. The other thing I will say, examination needs to be thorough, structured, and systematic examination. You should be focused. Now, how to do it is practice and practice and practice. A lot of people think, I will get it right on the day. You won't if you have not been practicing. And senior examiners or examiners will pick up your flaws that you have not been on the ward and not been practicing. So, and when you practice, you should do it in an exam setting. So do not cut corners. Do go through the examination process, any system, the cardiovascular, respiratory, neurology, and it should be structured, as I said, systematic, and do not cut corners. And then once you've done that, you will, or you all know that you will have to think of how to present what were the positive signs and how, and always think of a differential diagnosis, because that's what you will be asked to, and justify your differential diagnosis. And many a time, if you get your signs right, and you've got a good valid differential diagnosis, even if you do not get the right answer of the diagnosis, you will pass if you can justify to your examiner that you have been very systematic through your thinking process and that you came out with a very valid differential diagnosis, as long as you've got investigations in plan to confirm the diagnosis. Now, I will keep it brief. I'm sure others will give much more lovely tips. I've given you a tip from a, how would I say, very old-fashioned way of doing things. But I know we have got young consultants who are examiners as well, who might give you much more practical skills. Thank you. Ask me any question if you want.
Right. Thank you so much, Dr. Azim. I think that was a really very well valuable information, especially for people who will be taking PACES in the coming months. And I'm sure your experience as a valued examiner with all the years of experience will be very valuable. And thank you so much for agreeing to answer future questions if anybody has any further questions. So we will now move on to Dr. Mehboob Hussain, who is again a very senior consultant and MRCP PACES examiner. So Dr. Mehboob Hussain, if you had any valuable tips to share with anybody with regards to MRCP Part 1, Part 2, or PACES exams.
Mehboob, we are muted.
Dr. Mehboob Hussain, you're muted, so you might have to unmute.
Yeah.
Yeah.
Okay, good. Thank you very much. I will start a little bit from part 1. Yes, initially when you started in this country, we came from home with all this OTM, started the Oxford textbook, all those things. At that time, we didn't have any question bank or all those things. So it's important, as the study method is exactly the same as he mentioned. Go to the questions again and again. But in some cases, just read the question carefully, because they just add some adjectives, and that is the problem. So although 30 to 40% questions are repeated from the previous old bank pool, but they change the adjectives. In that lines, known questions, you can score 0. Just read all those things, number 1. And I was writing the part 1 questions when I was my next few years of last 2 years of SPR. It's all are actually real patients done in the by the question writers, verified, ratified by the moderators. So this is very important, as have been said before. Practice again and again. In our time, it was unless you do at home situation with the clock on the table, 80% don't attempt. That was our time. So 80% means you are going through. And I didn't know that. My Pakistani colleague, who was my partner, and he just showed me. I'm very grateful to him. We worked together at some stage. So it is always better to have a partner. Write it down. At that time, we have been using Parveen J. Kumar. Now we have got question book or pool. You write on the side that what are the missing factors. If you check yourself that the same question, same area, you'll be missing again and again and again. And at that point, you need to read the topic a bit. Where you are missing, why you are missing, and get the pathology or system corrected. Otherwise, the same thing will keep on coming. Regarding the part two questions, we have with the diabetes and everything, also DVLA. There are few questions come from DVLA. Just read those things, DVLA, when to refer, what is the things we have to look after. Again, going back to the part on, we have been dividing that, how many colleges are clearly given, how many questions comes from infectious disease, how many come pharmacology, how many statistics. So we have corrected ourselves that I cannot miss pharmacology. 5 questions, I will get 50 marks, 25 marks, something like that. So those are the things you plan yourself. Regarding the pace, Azim has spoken a very nice and concise way. As I say, as he said, that practice again and again. There's no alternative. Nowadays, this is a British exam, and the things they have changed over last 10 years. So many changes have happened for pace, and mostly nowadays they are thinking, because we are giving why this has come to communications consultations, because outpatient people are not performing well. So exam is being treated as if the same we are practicing in the outpatient. So make your exam day the same day you're practicing in the ward. So it is just normal day. And obviously, there are a lot of suggestions in the YouTube and all those things. You have to come with the smart and the dress as well. I had a candidate coming from Dubai. He forgot to bring his stethoscopes. I had to offer my stethoscope to him. So that sort of things can happen. Come well ahead of time. The mostly female, no nail polish and all those things. Be a bit modest and just like smart exam day. But main thing is, as Azim said, if you even fail the diagnosis, it doesn't matter. If you go to the college of suggestion that differential diagnosis is most important, and your diagnosis must be included in this thing. When we have to prompt what is the diagnosis, how you come to, just exactly the history. I remember when we have been doing our history taking Dhaka Medical College, that differential diagnosis, then clinical diagnosis. How do you exclude? How do you include? And when you are thinking in that way and structured way, as you say, inspection, palpation, we had to examine candidates just examine the patient, jumped on the patient bed. No, that's you're missing the inspection mark. You have to show and convince the examiner that you're actually inspecting the patient. So same system continues: inspection, palpation, percussion, auscultation. Those are the things you have to say that in the exam. Consultants usually say, examiners, oh, he is very, very methodical. He is his clinical acumen is very good, and you will get full marks. Now, other thing, do not manufacture any science, people, because examiners, before going to the examination, they examine each and every patient. 2 person go there, examine the patient, they decide which are the positive markers with the negative markers. If they say this thing, we'll penalize him. If they say this thing, we'll make him pass. That sort of thing is decided. They have to write it down, and accordingly you get the marks. So, and there's no alternative. Practice and practice. And even other thing, we usually take a week off, 2 weeks off before the exam. I wouldn't suggest that personally, because when you take off, you lose your clinical smoothness. We understand the people have not. You have not touched the patient. I can see you from examining your tummy. So don't let the people say that you have not examined the patient. Every day, examine before last 10 days of examination, examine the patient morning, evening with a partner. Our time, I'm sure people have the same experience when the registrar teaching the 3rd year, 4th year, 5th year, and I used to go the other side. Now I'm going on the other side of the table. You just criticize me, which are the things I have been excluding silently. You won't understand that you are missing the same thing. So please try this one. So there is no alternative to examining the patient's methodical way and structured way. That's my suggestion. Thank you very much. If anyone has any further questions, I'll be able to answer.
Thank you so much, Dr. Hussain. Again, really great, valuable advice for people, especially who are going to be sitting for the PACES exams. So at this point, I would probably want to bring in Dr. Saeedur Rahman, who is a stroke consultant in NHS, and he again is an MRCP PACES examiner, and I'm sure everyone would really get great value from listening to his tips.
Are you sure? I'm not sure, but anyway, we'll give it a go. So first of all, Halim, I absolutely loved your presentation. I think you've made it very simple, and it's very pragmatic approach how to go about MRCP Part 1 and 2. And almost felt like I'm sort of hearing what I used to do when I was preparing for Part 1 and Part 2. So it's a different exam, isn't it? And you have to play the game. So I agree with you. I think studying just simply the text probably wouldn't cut it. So you have to go through the question banks. But also what I liked is that you suggested that when you practice a question, if you find something that you haven't understood, you go back to the text and you clarify the information. It actually gives you a lot more pleasure in studying, and I immensely enjoyed it when I did it. And you retain a lot more. I also think that what you suggested about the mocks is really, really crucial, because it's a very highly time-pressured exam. So trying to get that stamina built up is quite important. So yeah, I think what will be helpful is in future, if you can deliver a couple of more sessions like this for the youngsters, that will be really helpful for them. In terms of the PACES, what Dr. Azim and Dr. Mehboob has suggested, I'll just like to echo them, what they've said. One thing I would say is, as both my colleagues suggested, that you cannot turn up on the exam day and expect to perform. So you have to sort of take every day in your clinical practice as if you're actually in a PACES exam. So practice the way you would actually do it, so it becomes a second nature to you. Nothing ticks an examiner off if he or she sees someone who's not fluent enough, and they just lose the confidence in the candidate. Even if you're saying something right, they may at times switch off and don't listen, pay attention to you. So every single patient encounter in your daily clinical practice, take that as an opportunity to practice your PACES skills. All the best to everyone. Thank you.
Thanks, Dr. Rahman. Again, really valuable advice. I'm sure about this. Don't worry. So, moving on to Dr. Amanat Ullah. He's currently working as a acute medicine consultant and is again a PACES examiner. So, Dr. Amanat Ullah, can I invite you to, and can I bring you in to share your valuable advice about how to excel in the MRCP exams?
Thank you, Ryan. Thank you. I was just listening to Dr. Halim, and I was bemused actually, because in our time we had a lot of struggles actually. Which question bank is available? Which one is the best question bank? And I actually, before giving MRCP Part 1, I don't know actually. I didn't know which question bank I have to go through. There were a couple of there, and they were expensive as well. So I would suggest not to go through 2 or 3 question bank. Just select one question bank. Any question bank is enough. Any of the question bank is okay, provided, because most of the question banks, they cover the system. What we are going to look at the question banks. Question banks are important because we need to see from which system, which disease they are looking for actually, which answer they are trying to get. Suppose which topics they are covering. Most important, from the question bank, we need to get the topics that they are covering. And most of the time in MRCP Part 1 and Part 2, the questions coming from the same topic. So topic is most important. Suppose in neurology, thousands of topics, but most common topics, peripheral neuropathy, GBS, paraplegia, stroke. So there are very few common topics from where questions will definitely come. So this is most important that we don't miss any topic that is out of our knowledge. If it's not if we don't go through that topic, then we don't know how to answer them. So that's why question bank is very very important. Um, Another most important thing is I have noticed few of the candidates passed MBBS, didn't join in training, started preparing MRC part 1 and part 2. So I would definitely discourage that one. 100% importance is to join in training. If you don't join in training, you can't pass. You can even pass, it's okay. If you have very good knowledge, you have very good internship experience, then you can pass. But training is very, very valuable. So when you join in training, you will have the exposure of all the patients. If you go to a tertiary hospital in Bangladesh, very, very good hospitals, and you can have the all um, kind of patients are there. So when you start seeing patient, correlate with the question bank. See one patient, see one topic, and see which questions are coming from the question bank, and then don't rely on the question bank answers. We just need to know the questions. Answer is basically with yourself. You got the topic, you know the questions, what kind of questions they are bringing up in MRCP part 1 and part 2. Then go through any of the textbooks. I would prefer if you go through up to date or guidelines. Already Dr. Halim, Dr. Mehboob, already they have discussed about the importance of the guidelines. What are the guidelines we have to go through, and how many times we have to revise those guidelines. So most important is question bank, number one. Number two is join in training. Number three is correlate with your questions with your patient. So suppose you have seen a patient, suppose you have seen a question from the question bank, but you have not seen that patient. So try to find that patient. Ask your colleagues or ask your other ward colleagues or friends. Have you seen that patient? Do you have any patient like that? So if you go and see that patient and then you can correlate with the books, it will be much much easier for you. And then you will not miss any topic and you will not miss any answers from there. This is number one. Number two is there are on MRCP part one, there are few neglected topics we have noticed. Number one is pharmacology. Number two is statistics, and number three is genetics. So if time permits, I would suggest if Dr. Halim can just give us some idea how to cover statistics, genetics, and pharmacology. So those are basically theoretical. You don't need to see patient, so you just need to see where is the good evidences are there. Suppose in our time, I can remember I have gone through the USMLE statistics questions because those are very easy and easy to digest and easy to produce as well. So you can't miss any if you go through that topic. So I think for this topic, these three topics, don't neglect this. It will bring some good numbers because question can vary time to time. In one diet, question can be easy. In another diet, question can be very difficult. So and whimsical as well. So if you think that you are very good in clinical knowledge and you have very good clinical exposure, but if you neglect those three topics, you might not pass. Number two is another one is for MRCP part two. Very, very important is imaging and ECG. So if you have time, go through imagings. If you see that which images are coming, actually they're asking for which images. So you can go through the Radiopedia, you can go to Up to Date, you can go Medscape, and you can go through see the images and clear your conception. What are the images are coming in the exam and how can we interpret those images? Very, very important. Don't miss any ECG. Most of the time ECGs are very common. If you have gone through the ECGs, you will not miss. So these are the certain thing that is very, very important. And preparation is basically, I think 3 months is enough, 3 to 4 months. Some it depends on the experience of the candidate, and in 3 to 4 months. And don't think that I will in last 1 month, I'll go through the question bank and I'll go for exam. Not like that.
Mhm.
Every day, go through 10 to 15 questions. And when the next day you are going to see the patients in the ward, you can see those patients in the ward and you can easily correlate and get the answers. Discussion with the friends or colleagues is very, very important. Reading partner is very, very important. That can give us the sharing of knowledge, and also we sometimes we miss some topics that my friend or my reading partner can help me to get that topic as well. Uh, so these are the few things about MRCP Part 1 and Part 2. Those who have passed plab, we have noticed that few of the doctors has passed plab and waiting for applying jobs. Job is slightly difficult at the moment in UK, but if you have MRCP Part 1 and Part 2, there is a higher chance that you will get the job, because most of the time in our interview, we ask whether they have any post-graduation experience there or not, or there are any post-graduation exams they have appeared there or not. So definitely MRCP Part 1 and MRCP Part 2 will help them to improve their CV. So I think these are the few topics. Let's see what the candidates or participants are asking any questions or not. Thank you.
Thank you so much, Dr. Amanat Ullah. Again, really, really valuable advice, which people can take back to their own practice. So over the last around half an hour, we have been blessed to hear the valuable opinions of our principal speaker today, Dr. Halim, as well as our wonderful group of panelists. And now I would like to open the floor for questions. So just to remind you, the way to ask questions would be to post these questions on the chat box. I'll be keeping an eye and trying to answer as many of them as possible. And while we are waiting for the questions to start coming to us, I'll probably take the liberty of asking a few questions to our speakers and panelists. So Dr. Halim, starting with you. One of the things which often happens is in the field of medical education, there is a thing that says that there should be a constructive alignment between what you are training for and what you get taught versus what you get assessed in the exams. So MRCP is a British exam. So basically this alignment is between the British training and the type of patients they see in NHS and the questions in that appears in the exams, which are centered around those training. So what would your advice be to doctors in Bangladesh who are training in an entirely different health system, where they may not be necessarily seeing the same patients and the same conditions, and then they start appearing for PACES, for MRCP exams, and they often might lose the motivation to train. But whereas we talked about the importance of training, so what would be your advice in this tricky situation?
Okay, so yeah, this is a very nice question, and I'll share an interesting fact. Like, I'm a cardiology resident, and the way we practice versus the way the question comes in MRCP Part 1 and Part 2, I'd say sometimes they have some contradictions, like the usual practice, the first choice of drug or first choice of test does not always match with the one that's given in the Q banks or in the RCP website. So there will always be some conflicts. I mean, I got less mark in cardiology than neurology, despite being a cardiology fellow. And that would often happen with, I mean, every system we go through. So I think in those cases, you have to just follow the nice guidelines and try to remember those facts, or try to take notes that that's why what we do versus that's what we should answer in the exam. So you have to be very careful about those, because it's very easy to choose the one that you are doing every day rather than choosing the right answer. What you're doing every day is not always the right answer. So you have to like keep an eye, like this is what nice guidelines says and this is what we are doing. Here is the difference. And I should always keep track of that and write it down and like memorize it. I mean, that's the only way to like do well in the exam. I mean, regarding those facts. But I would say those does not constitute the bulk of the concepts. I'd say like 95% of the things that is the best practice in our country is also the best practice in the UK. So whenever you are dealing with a patient, always try to follow the guidelines. I mean, there are few exceptions where guidelines does not have the same recommendation, but most of the times the recommendation will be almost the same. Like for UK, that European Society of Cardiology guidelines versus for US, the AHA guidelines, they are almost similar, despite barring some exceptions. So whenever you're dealing with a patient, try to always investigate the patient according to the guideline and treat the patient following the guideline recommendations. So rather than following text, following the guidelines will be your best strategy in those regards.
Thanks, Dr. Halim. And I think it also underscores the extra hard work that doctors in Bangladesh probably have to do compared
Yes.
to trainees, for example, working in NHS, because they have to simultaneously have a practice in certain ways. They have to change
Yes.
their practice based on trying to follow the international guidelines, which is not always easy because you always have to work in the constraints of the Bangladeshi resources, which may not match the guidelines. But then you also
Yeah.
have to change your own study pattern so that you're practicing in one way, but you're aware of the
Yes.
guidelines as well, which is very difficult. But I think that's really important, and I think it's important that we talk about the difficulties because it's not about a bed of roses. MRCP is a difficult exam, so I think it's very important that we acknowledge and are reflective of the extra hard work that doctors in Bangladesh would have to put in to pass this exam. So thank you so much.
Yes.
That's really helpful advice. Uh,
Yes.
the next the next question I wanted to quickly ask Dr. Halim is, exam is like a performance. So regardless of all the hard work that you have put in the months leading to the exam, you still have to perform well in those 3 to 6 hours during the exam. And if you don't get your act together, you might not succeed in spite of all the hard work that you've put in. So would you have any specific tips of what to exactly do in those 3 to 6 hours during the exam to succeed?
Okay. So the best thing you can do for preparing for the 6 hours is the previous 3 months. I mean, you have to prepare really well. Don't just focus on passing, rather try to master each and every concept and try to make the best preparation that you can take in those 3 to 4 months or maybe 5 months. And then before the exam, you must take the mock, you must time yourself. And don't try to complete the mock exam within 3 hours. Rather, I would say you should take like 2 hours and 30 minutes or 2 hours and 15 minutes. Try to constrain yourself, try to push yourself hard in those mock exams so that you can train your body and mind to like withstand the pressure on the exam day. And you have to also go to the exam center, be familiar with the setting, and maybe you can go inside the exam center, talk to the guard or staff, where it can rest, what kind of food will be provided. I mean, those things are so petty, but they're so important. And also make arrangements for your transport before the day. Like if you have a car, have the car. If you don't have a car, uh, book the Uber for that day. I always book a Uber before the day. I know exactly that when my Uber is coming, because you should not have any worries about those. And what kind of food you are eating, you have to like prepare it before the day and take it with you. And where you sit in that 1 hour gap, you should also make an arrangement. That's the place where I will sit and maybe take a cup of coffee. It's so simple, but so important to keep you energized for especially the part of paper 2, because that's where everybody like struggles to maintain the same speed as paper 1 or the part 1.
Yeah, thanks, Dr. Halim. I think this might sound petty discussion, but these are really, really important because it's like a performance. So you have to get your act together in those 2 to 6 hours. So Dr. Azim has kindly got his hand up. So I'll bring you in, Dr. Azim.
I just give a practical advice as well. So Dr. Halim has said all the right things. But one other thing as I would say is that when you are looking through the questions, answer the ones that you know, you're sure of. When there's something you don't know much, you have to think about it, move on, keep marking them, and then keep completing the ones you know, and leave enough time to go back and think about them. But sometimes we can bog down with a question. I think I know it. I think it is. Keep thinking about it and lose very much precious time when you might still get the answer wrong. So go and start doing the questions you want to know. Keep going. Keep marking them that you've not. Then go back to them and then start making some guesses, which is informed guessing as well. So I think that way you will have the better chance of giving the right time for the question you know, and then rather than at the end, if you have kept pondering about the question that you don't know and wasted 15 minutes of time, and then at the end you will be rushing with the answer that you already know and might make a mistake as well. So that's one thing that I think always helps.
Thank you so much, Dr. Azim. That's really valuable advice. And again, as I said, ultimately, we don't talk much about what exactly to do in those 3 to 6 hours. We talk about all the preparations, everything that you need to do beforehand. But having worked in NHS, I know for a fact how important those exam performances is. And there needs to be I feel almost like a separate group of study teaching you exactly what to do in those 3 to 6 hours. So I'll bring in one question from the audience. So there is a question from Dr. Muniat who asks, would you please give us some guidelines who are new to this journey? So would you please give some guidelines who are new to this journey? I'm an intern doctor right now, want to prepare for part 1. Would you please guide me about how to start? So in general, this question probably applies to everyone. So if you're a very fresh starter, just finished MBBS, and you want to succeed in MRC part 1, what would you do from day 1 of after passing MBBS?
Okay, so I mean, if you are in your day 1, you have to first decide, like, when are you taking the exam? That's the most important decision, because that will guide you, or how much time should focus on this, and what kind of resources you can afford to study in that. For example, if you are taking the exam like 1 year or 2 years later, then I would say you just do your internship really well. And whenever you are going through the medicine ward, keep your Oxford by hand. And whenever you're seeing a patient, go through Oxford, and also have a Q bank. Maybe we have the hard copies of Q bank in Bangladesh. Maybe go through the Q banks regarding the patient that you have seen today, or the system that you are studying. So, like, you'd have a soft study. But when you are targeting a specific diet, and you are maybe 6 months or 4 months away from the diet, then I would think you must register or subscribe to your online Q bank. Maybe PACE Medicine is probably the best Q bank, because it has all the detailed explanations. So that would be the best Q bank to go and to subscribe online, and start studying start doing the questions every day, and try to increase the number of questions that you solve every day. Like after each 1 or 2 weeks, like start from 10, then 20, 30, 40, 50. The more, the better. And that should be from the very first day. Don't keep the question banks for the last 1 month.
Thank you, Dr. Halim. So with your permission and with the permission of the panelists, just because our webinar is starting to get a bit more interesting right now, we have more and more questions coming in. With everyone's permission, can we just extend the session a bit more? So I know we're meant to finish at 4 p.m. So I'd like to take the permission of the speaker and the panelists. And if anybody has any objection or needs to leave, then thank you so much for joining us. But we probably want to just extend a bit more, if that's okay with everybody. So
Yes.
thank you, Dr. Hussain. Thank you.
I have no problem. Yeah.
Thank you so much, Dr. Halim. Thank you so much. So Dr. Halim, moving touching on that point, one of the things they often teach in medical education is self-regulation. So again, this is not something I keep on referring to these things because these are not often well taught in our MBBS curriculum. And I can tell that because I've myself given MBBS from Bangladesh. The importance of self-regulation is how, as a trainee, you need to constantly reflect where you are versus your target. So you need to start giving yourself a target that, I need to give my part 1 exam this date from today, 1 year from today, or 6 months from today. So you start with a target, and then at regular intervals, you reflect where you are versus where you should be. And if things are not working according to plan, you try to understand why things are not working according to plan. Why are you not in the same stage of preparation as you should be? And what you need to do to correct and make up for your deficiencies. These things are probably really important in your journey, isn't it? Because ultimately, it's not an outcome of just passing. It's the whole journey, and you need to get the journey right, isn't it? Yeah, brilliant. So I think
yes, absolutely. I mean, sometimes I would have some topics like I had difficulties with pneumothorax. I had difficulties. I mean, I studied it multiple times, but every time I study, I forgot the sequences, what to do in this type of pneumothorax and that, because the way we practice in our country does not match the guidelines, or whatever written in Davidson does not match with whatever written in Oxford. So there are so many contradictions. So you will have some topics where you will feel not on the right track. You will feel, I mean, we are not achieving the goal. You are getting this wrong again and again. So you will have like 1 or 2 topics or maybe 5 topics like that. That's where you should not lose track. Rather, try working them again and again, because that's where your money lies. You have to like clear those confusions or make those confusions, your strength. So, so whenever you have those targets in mind, like I have to complete this, I have to master this, and you are not getting those targets, don't lose hope. Try with a different way. Maybe write it down. Maybe talk about this with a friend, or maybe take help from someone. Like, please tell this concept. Please describe this concept to me so that I can remember. So you can always take help from someone else, especially in those areas where you are not achieving your targets.
Yeah, thank you. I think that's really helpful advice. So I probably move on to the next question from the audience, and this probably applies to people from the panelists today who joined NHS after clearing their PACES. So there's a question which says, for us Bangladeshi candidates, the steps after completing PACES are not well known. In today's webinar, there are many respected doctors who are currently working as consultants in UK. If they could guide us about the process of what happens after PACES and how you can excel in your career after PACES, then it would be really beneficial. If anybody wanted to come in on that.
Yeah, go ahead. Anyone can talk what is happening after PACES. Just look for the job and go to training number. ITM 1, 2, 3. As I think someone mentioned, job is difficult, but still, when you complete the PACE, chances are more. We know at one stage, we all went to Bangladesh, got the people exam trained, and then given the job. But nowadays, if for one application, one post, 400 to 500 people are applying, maybe more. And then it is a real competition. And when we mark the people as a one shortlist, there's a people is not nepotism. We have to mark with specific achievements, ALS, audit, postgraduate, everything we have to mark it down. And the HR will only call the people who are top on the that marking. So the more you add to your experience, the more you'll be on the forefront for the job. And ultimately, going for the UK exam, UK PACER only for the, we all have aspirational or hope that at some stage we will be incorporated to the UK job. So that's we have to prepare. Just one thing it came to my mind: those who are going for the next diet, I think we should think about ethical question about assisted death. It is going to come in some way or either, and the obesity, which is very prevalent nowadays. Assisted death is a hot topic. It will come, I'm sure, at some exam somewhere in ethical questions. Thank you.
Thank you so much, Dr. Hussain. I'll bring in Dr. Saeedur Rahman. If you wanted to add anything to this.
Yeah, just wanted to highlight something about that question regarding what happens after PACES. So we have to realize that getting your MRCP doesn't really qualify you as a specialist in UK. So it sort of sets the foundation for you to go into higher training. So once you've got your PACES, then with the right kind of experience, you can apply for a registrar training job. But you also have to realize that if you haven't worked in NHS and in the UK, you'll be coming in fresh and without having any idea about NHS itself. So landing a registrar job upfront may not be the best way forward. So you probably need to have a bit more experience going into that. What you don't want is that you're coming in as a registrar, having that added sort of expectation to perform. Whereas if you come in as a slightly lower grade, like in a SHO grade, potentially that gives you enough time to sort of get used to the system and then build up your portfolio and then apply for the registrar job going forward. That probably will put less pressure on you. I'm not too sure what you think, Latif, about that.
Yeah, Dr. Rahman, you're absolutely correct. I, for example, started as a registrar directly after MRCP, and I know how difficult it was, the transition. And obviously, you can get it right and you can get it wrong, but it always, it always is difficult. But equally, I also know that Dr. Amanatullah started as a consultant because Dr. Amanatullah probably had the right credentials to succeed as a consultant after MRCP. So I think your advice is in general very valid because for most of the people who do MRCP, they would do it soon after their training, soon after passing MBBS within the first 5 years, and that probably isn't the right amount of experience to immediately prosper as a consultant or a registrar. But again, it can vary individually. But in general, I do agree with your advice. The next question, as an extension to that question, probably one for Dr. Halim and Dr. Amanatullah, is if you pass your MRCP but you do not want to come to UK, but you rather want to stay in Bangladesh, what's the career prospect like after passing MRCP with an MRCP degree in Bangladesh? Dr. Halim and Dr. Amanatullah, I'm specifically asking you this question because I know for a fact that after your MRCP, you still stayed on in Bangladesh for a few years practicing medicine in Bangladesh. So probably you might also help us with this question. So Halim, do you want to go first?
Okay, sure. So I'd say if you are doing only MRCP and you are a government doctor, then you need something else to help you propel or excel in your profession. Because what do you know that if you don't have the clinical training from the UK, then your MRCP won't be counted or you won't be counted for promotion. So you need to get that specific clinical training from the UK to count the MRCP as a degree to, get the promotion. But if you think of the private sector, if you are doing an MRCP, you will still be a consultant. You will work as a consultant in the private sector. You can become a senior consultant. So you will have all the privileges in the private sector. I think no problem at all in getting up the ladder of the private sector. But it will be an issue in the government sector. You have to get like an MD or some other degree from Bangladesh to excel. But I'd say anyone who is a super specialist, like I am training in cardiology, so I don't have an FCPS medicine because it will take so long. So anyone who is going for a specialty degree in Bangladesh, such as cardiology, neurology, or whatever super specialty you're going to, I think you must have a medicine degree, and that the preferred one would be MRCP because you can complete the MRCP within your training period, and you can get the super specialty degree. Plus, you're also getting the flavor of medicine, so you will become a very competent specialist because you can deal everything that the patient of your specialty has because he has cardiac disease, but also has diabetes and hypertension and all that. So I'd say to become a competent doctor, you must do an MRCP. And in the private sector, you have like boundless opportunities, but the opportunities are a bit limited in the government sector because there is this separation of MRCP by the other exam bodies in our country who do not want it to be counted unless you have the specialty training in the UK.
Thank you, Halim. So in one word, what's the highest position you can reach with only MRCP in Bangladesh?
In private sector, you can become anything. You join a private medical college, you can become an assistant professor, an associate professor, but that will not happen if you are in a government sector. Maybe we previously seen some assistant professors, but now even you cannot probably become an assistant professor with MRCP unless you get that specialty training from the UK and you count that as a diploma.
Thanks, Dr. Halim. So I think
Yes,
message is quite clear.
I think Latif, you are right. MRCP is a diploma. Few years ago, when the Bangladesh BMDC came here to have the discussion with the UK Medical Council, because you know that Bangladesh has downgraded MRCP after the FCPS. I'm sure you are all aware of this thing. FCPS first, there are situations the government has graded. PhD, they have given the first, FCPS second, MRCP third. So at one stage, they all cancel each other's qualification. MRCP has not been recognized in Bangladesh. Similarly, here, FCPS has not been recognized in UK. So when I was going for people for SPR training, Even SPR, FCPS from Pakistan, we have disregarded that. The government is not accepting this sort of things. So gradually now we have got center in Dhaka for MRCP, which is probably Evercare has had its first exam happen. So they are getting close together. So hopefully in future it will be re-evaluated and see how it goes on. But private sector, again, oh, I have to mention one thing. I had a candidate which she has got FCPS from Bangladesh, then did MRCP. Then I offered her job here as a registrar. She's the only person, she said, no, I will go for SHO first to learn the system. She was quite right. And now she is a registrar in SPR in somewhere in our area. So sometimes it can happen. The other person, again, take opposite way. She was oncology practicing some private hospital. I name in Dhaka. Now she asked me. She's one of the lady from one of the girls' cadet college, which I'm well aware of. So and she got the very good hospital, university hospital. Now she's registered in oncology. So things are probably, it's in some stages better to know that it's not the knowledge system is quite different. To 6 months is not a bad idea to become acquainted with the system in this country. That's all. Thank you.
Thanks, Dr. Hussain. Thank you. That's really kind and helpful. I'd like to say a special thanks to Dr. Azim and Dr. Saeedur Rahman, who obviously managed to stay with us till the entire length of the program for their valuable advice and presence. They have had to leave us now. I will at this point I'll probably bring in Dr. Amanatullah. Dr. Amanatullah, if you can still hear me, would you have any advice on post PACES things to do, especially if you're in Bangladesh? So I think Dr. Amanatullah has got disconnected, so I will move on. So the next question, which is actually a very interesting question from Dr. Sauban, is in UK, when they do MBBS, their training, the curriculum is such that you move on from undergrad to postgrad in a seamless manner because it's just a continuation of your degree. Whereas in Bangladesh, things may not be matched together. So the question is there any way to, or is there a way you would integrate your MRCP preparation within your MBBS studies? Halim, you have been teaching undergrad a lot, isn't it?
I would say definitely it's a very good question. Very good question. And if I would start my 5th year or 3rd year studies again, I definitely try to integrate those things into my study, especially the QBACs. You can always go through the topics like medicine topics. You're going through Davidson. And whenever you're studying a topic, you can check your knowledge by going through the QBACs. And that will not only help you to retain the topic or understand the topic really well, but also will obviously help you to excel in the exam. So I'll definitely do that. I'll definitely integrate those QBanks and those study materials of MRCP with my study. But oftentimes it becomes so difficult because whenever you are studying in MBBS level, there are so many things going on. You have to go through different subjects, different lectures, words, and so many things. So I'd say, postgraduate training seemed easier to me than undergraduate training because MBBS, I and Ryan were from the same batch, and it was so tough, mentally and physically so tough to go through all this curriculum, especially the toughness began from 3rd year because so many subjects, so many words. So oftentimes it becomes difficult to integrate all this, but if you can, definitely do that if you can manage the time.
Thanks, Halim. That's really valuable advice. So regarding the QBanks, there's one specific question for part 2. Which QBank would you, if somebody only had one QBank to finish, which QBank would you suggest?
Definitely that would be past medicine.
Okay.
If you go for one QBank, because the level of difficulties with past medicine, I would say actually reflects the exam level.
Yeah.
But obviously past test is also the second best one because the number of question is highest in past test.
Yeah. Okay. And
past medicine
same for part 1?
Yeah, same for part. Past medicine will be your go-to QBanks, but I would suggest to solve as many questions from as many QBanks because that will give you some overall perspective if you get the time. But if you are constrained with time, go for one QBank, at least past medicine. That's the first choice. Second choice would be pass test if you have time. And obviously, if you have luxury, then obviously go to on exam. The
Yeah.
number of questions are small, well, is less, but the questions are very well structured.
Yeah, brilliant. Thank you. Thank you. That's really helpful. Moving on to Dr. Hussain, but just because you are involved probably in recruitment in your own workplace. So there's a question about getting a job in NHS. So the specific question is, what's more helpful, getting a postgraduate degree after PLAB or doing a clinical attachment in a hospital? If one had to choose between these two.
Yep. I know it will come. We have been trying to do something after discussion with the Kausar, but again, the things are both difficult. We have been trying to get some of the clinical attachment. We are in competition with our counterpart of India and Sri Lanka, where there are most Bangladeshi consultants. I'm sure we have some collection in Kent. I know he's there. So I have been encouraging all my colleagues who have registered that please try to recruit as much as possible, especially clinical attachment. So clinical attachment helps for getting the part two as well, because I have seen people coming from Pakistan, India, they get their consultant, do 3 months here, and they get the exam very easily. It will be really difficult to do the clinical or PACES from Bangladesh, but they need to have some sort of exposure. That too, my belief in UK. Otherwise, it's a different system, different questions. Because we even, I have seen the people in the exams examine the pen. He just jumped on the bed and then started pricking his hands with the pin. See the sensation. Obviously, he'll be failed. So there sort of things it doesn't mean that how much he knows, but that's the system we need to learn from this country, and that will help everyone.
Thanks, Dr. Hussain. And so that's really valuable advice. And Doctor, I did, I think one of like, having being somebody who started working in NHS within the last 5 years and seeing a lot of people who have been recruited in my own local workplace as well, I'd probably say that if you've completed PLAB and or want to come to UK, you probably don't want to waste further time trying to give a postgraduate exam like MRC Part 1 or Part 2. Just focus on getting a job as quickly as possible. And one of the things which is
If
increasing,
possible.
yeah, exactly, if possible. And one of the
We
things
have,
which
I have the, I'm sure we have some kind, almost 25 to 30 people have done the PLAB waiting. I get the request some way of either, but to get them involved in training or job. And it's Latif, it's very, very difficult nowadays.
it's difficult, yeah. But I think one of the things which is increasingly happening after PLAB is if you can immediately, because you will have an extended visa for a few months beyond your PLAB exam, if you can use those few months to do a clinical attachment at least in one hospital and to complete your ALS, these are the things which probably will give you the edge in getting a job. But again,
That
these are very difficult.
that trick has been done by some Sri Lankan. You were saying at semesters, don't go back after PLAB. Arrange someone, get the local at least 6 weeks, 4 weeks, whatever time left, do the attachment, you get your local referee, and that will help. And some of the from Dhaka, some of the medical college people did the same thing. I know the people from Solimullah, basically they did. From few of them, they got the job in that way. But whereas from our other medical college, they just came, gone, passed the PLAB, gone home, and then after 6 months or 1 year, they're writing to me or some other friends, and that becomes very difficult. Getting the visa is very difficult. And nowadays has become more difficult because of the current situation in Bangladesh.
Thank you, Dr. Hussain. I think that's really important. I think it's really important to try to secure clinical attachment immediately after your
Yes.
lab exam. That's the smartest thing to do. And I'm sure everyone will agree with the next answer to Dr. Muniat's question is the possibility of getting a job in NHS after Part 1 in PLAB is difficult right now. The competition is really high, and you probably have to give yourself a window of at least 1 year and loads of applications in loads of places and being very flexible and open to the area of UK where you want to work to get a job. It's not, it's very now it is very uncommon to get a job immediately after getting a PLAB. You often have to wait for a year and make loads of applications. So we probably have just about enough time for me to ask one final question. I think this is an important question to ask because we don't often talk about it. We talk about success, a lot. Obviously, we get to know what is needed for success, but we don't often talk about failure. But the fail rate in MRCP is not low. It's almost as much as 50% in across all the different exams, part one, part two, and PACES. So if Dr. Halim and Dr. Hussain had any advice about how do you reflect and adapt after failing an exam, part one, part two, or PACES?
Halim, go ahead, then I'll
Yeah. Okay, sir. Thank you. So, I mean, it's an unfamiliar territory, what to do after failure. But if I think of myself, if I fail in something, I'll share an experience. Like I failed in physics exam when I was in class 10. And then I just focused everything in getting this physics right. And then I got the highest mark in the 1 year later. So whenever you are failing, don't be too harsh on yourself. Don't overjudge yourself, or don't let the people's voice let you down, because keeping your head high, staying positive is so difficult at that moment. But you have to like just drag yourself from this position. Don't lose hope, drag yourself and try to identify the mistake in your method. Probably you probably had enough time in study, but the way you studied probably was not the right way. So if you go for this exam again, and if you study in the same method that you did before, probably you will fail again. So you have to like think hard, and you may not yourself identify the reason why you failed. So you might need to talk someone who passed this exam, and tell him about your method of study. Share your method confidently, obviously, and confidentially, and ask advice like, I did those things, what else I should have done, or what else I should do in this time, so that I do not fail. And I think the one thing that everybody does, the main mistake that leads to failure, is studying too much, studying too many texts, and try to memorize every word from the text, like Davidson or Oxford or Harrison or Kumar Clark. Memorizing everything from a text does not help. So you have to be very focused. You have to focus yourself on the clinical problems rather than the words written in the books. So if you study a disease, you have to identify the areas of the disease which may be tested. Not all the information from a disease can be tested. You cannot make questions on everything. You have to make questions, or the examiners make questions on the particular crux or high yield points of that disease that relates to daily practice. I mean, each and every question in MRCP Part 1 completely focuses on the daily practice. So probably you should also get yourself to training as well. Probably you did not have much exposure to those patients, so it became an unfamiliar territory to you. So incorporate yourself to training, get to a very good training environment, get a good mentor, and talk to someone who has passed recently to identify your pitfalls. And then don't lose hope, stick to your target. You will definitely pass. Everybody passes, you will also pass.
Exactly, exactly. I mean, I always suggest, to add on what Halim said, failure is the pillar of success. So don't
Yes,
get put off with those things. I was making part one questions. At the time, they used to pay me 15, I was in Ireland, 15 euro per questions. Yeah. So, for example, it's all coming from the practical things. What I saw as a register, pleural fluid analysis. What do you get? And I made 5 questions. Okay, they accepted that sort of things. So all actually having from practical thing. Part one again, 30%, because I was involved in SPR exam, acute medicine as a moderator. So I know the 30% comes from the previous exam, but with caution, adjectives. They add always, sometimes, that sort of things you have to be careful. Same questions look the same, but adjectives have to be careful. So everyone in Bangladesh, they can pass the exam. I am not the miracle. I'm sure others are not miracle. We are all Bangladeshis, same medical book, and we did. When I started reading the book, I came from at the time our teacher said, "Oh, very difficult exam." So I started reading OTM, big one, CC Log, all book on my table. One Pakistani guy, he came who said, answer these questions. MCQ. At that time, we didn't Q bank. I could hardly make 30%. I said, that's what it is. Okay, leave those books. Leave those books, and that I am still grateful to him. And then this just answer this question, and then I want to answer questions and see what you did the mistake. Go back to the book, correct it, go back to the book. That's why we made, and then that is the basis of my part 2 MRCP. First part was the all knowledge I got it. I continued with the MRCP. I continued with the clinical, and that's how we have to clear in mind the questions, what or the topics we need to know. In Society of Acute Medicine, we say that only 20 disease in UK to pass the exam, even SPL exit exam. So there's a list of 20 questions, 20 diseases. We made the exam simple topic. Otherwise, medicine is a vast, big thing. Just 20 kind of diseases, actually all around different form questions are being made. So questions practice. Everybody said the same thing. It's not a difficult exam. It's a technical exam. So we don't have to go through the when we see FCPS. I was carrying the book. Our seniors are doing the exam. What you are doing, I'll carry you the books and the hammers, all those things. So I was carrying behind them what kind of patient they are seeing. And that's how we developed in DMC or PG. Just, okay, bhai, I'll carry your books and see what they're doing. So that sort of thing. Now things with the Googles, everything made a bit easier. So yeah, I hope everyone will do good. And it's not a difficult exam, it's a technical exam. So you have to know the way you prepare yourself, and we didn't have anything at the time to advise how to proceed. Now we have a lot of advisors, lot of colleagues, lot of seniors, and they can just ask for help. They will say maybe the method is wrong, the system you are adopting is wrong, but you will succeed. So don't lose hope. Thank you very much. I think I will end up here. Thanks to everyone. And we hope to, as a president of the UK alumni, we want to continue this sort of session. It's just starting, and I think we did very well. The next thing will come eventually surgical, obs and gynae, pediatrics. We wanted to do this thing for the last few months, but because of the other issues, I could not arrange this one. So Kausar has arranged, and Anis was behind this. I thanks to them all, and hopefully we will meet again, inshallah, in some other form. Okay,
Thank
take
you,
care.
sir. Thank you so
Take
much.
care.
Thank you,
Okay,
sir.
bye.